Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina at Hickory Spine, and today I want to talk to you about carpal tunnel syndrome, and in particular, what are the symptoms of carpal tunnel syndrome. So most commonly, you're going to find that carpal tunnel syndrome, if we look at the hand, it's carpal tunnel is compression of the median nerve. Now the median nerve comes up into the hand, it goes to the thumb, the index, middle, and ring right here on the inside typically. So you'll feel it through here. So basically this area inside of this finger. So mainly these three fingers, okay? So you can feel most common symptoms are going to be hand numbness, tingling, pins and needles, clumsiness of the hand, weakness, where it fatigues very quickly. You know, one of the most common things is a lot of pain at night, a lot of hand, arm, forearm, elbow pain is really common to occur at nighttime. Other things that we'll see happen are wrist weakness. You also notice that the wrists become weak. And so it's interesting and it's important to know that carpal tunnel can cause arm pain. It can cause pain because the compression here can refer into the hand and up. You know, sometimes you'll feel it in the elbow quite a bit. So those are the most common symptoms. At night, you know, the most common cause of the pain at night and why it increases is because people will sleep with their arms crossed. And so they'll take a wrist and put it down and up, and they'll sleep like this on their side, right? And then what happens is if you bend the wrist like this or like this for a prolonged period of time, just a few minutes, you'll start to compress that nerve more and you can make the symptoms worse. So in addition to the problem that's already going on with the wrist, bending it and compressing it and hold it that way, it creates a lot of problems. So that's something to definitely keep in mind. That, you know, those are some of the most common symptoms that we'll see. If you have any of these symptoms, if you haven't been evaluated, please get evaluated because there are a lot of things that can be done. There are a lot of things that are non-surgical and non-pharmaceutical that can be done. Those are the things that, you know, we do in our office as a first line of defense to try to help people with carpal tunnel. We use a lot of advanced therapies. You know, first of all, just get a good diagnosis and know where the nerve, because remember, the nerve in the hand starts in the neck, right? So it goes to the shoulder, the elbow, the forearm, and the wrist here, and it can be compressed to multiple places, causing something we describe as double crush that can be contributing to the wrist pain. I mean, I've seen people that have had complete surgeries, you know, they call release surgery. They come in and they cut this ligament, you know, hoping it's going to take pressure off the nerve, and they still have the same pain. So you know why that happened? Because it was the wrong diagnosis, because the problem was coming from somewhere further up the nerve chain. So elbow, forearm, shoulder, neck. I mean, anytime someone has carpal tunnel in both hands, I am always really suspicious of a common source right here. The neck, look at me. My hands and arms, the nerves start in the neck, they run down into my hand. Both arms, both hands, the nerves that are here are fed by my neck. If the disc that spaces the bones of the spine becomes so degenerated that it collapses and crushes the nerves that lead the neck, I'll have pain in both arms. That may just the only symptoms that might have there is carpal tunnel. But anytime you have it in both sides, you've got to be really suspicious of a problem with the neck or somewhere central, okay, something central where the nerves originate, okay. So anyway, I hope this helps you to better understand some of the symptoms of carpal tunnel syndrome. If you'd like my opinion on it, just reach out to us, give us a call. My staff will help you out. Our phone number is 828-324-0800. We have a lot of non-surgical advanced therapeutic approaches that we take. We have non-surgical spinal decompression therapy. We have super pulse laser therapy that's non-thermal, non-burning. We have peripheral nerve rehab therapy. It's a form of nerve rehabilitation that uses a type of electrical stimulation of the nerve that helps it to improve its function. We have infrared and red light therapy that's beneficial. We have lots of different approaches. You know, we can do soft tissue work, joint manipulation, recommend home therapy. So there's a lot of different things that can be done, and you really need to exhaust those options before you move on to more invasive therapies. And we always take people through 2-week trials. That's what we do in our office. We do a 2-week trial. First, we do an exam to see if we can help. Then we go in and I'll recommend treatment if appropriate. And then we'll do a 2-week trial and see if you improve. Typically, we'll see someone 4 days a week for 2 weeks. And I know it can sound like a lot, but you've got to have a good enough dose of the therapy to make a difference. And if you don't have enough dose of a therapy or enough frequency to make a difference, then you're not going to know if it's going to help. So you might as, you know, if you can't do it frequently enough, then you might as well not do it, if that makes sense. because it won't benefit you. So anyway, I hope this helps you to better understand carpal tunnel. If there's anything we can do, just give us a call. You can also find us at hickoryspine.com and learn a little bit more about our practice. But if there's anything I can do, I'll do my best to help you out or point you in the right direction. But I hope this has been helpful. Hope you have a great day. Thanks.